everybody here to Bloom Health Podcast, talking about pulmonary health, wellness, and fitness as well. And we're joined here today with Steve Shah, correct, Steve? And
Yes.
I would like to welcome, he is a prominent business owner in Pompton Plains. He's the owner, proprietor of Nature's Pavilion. And I welcome today as my guru of supplements, of wellness, and of great nutrition, I should say. um,
And now I got big shoes to fill now.
you sure do. You're going to, definitely. Well, Steve, tell me a little bit about yourself before we get started. Just tell people about your what got you into this business of nutrition and good health.
Okay. Well, we grew up in this business basically when we immigrated from India in 1979. My dad had already started this business, and he had gone through a lot of different businesses, and this is the business that attracted him the most. And he said, basically, this is what I'm going to do. I'm going to open up a health food store. This was in upstate New York, and basically everybody said, "You're crazy, you know." It's health food is for all the hippies only. And at that time, kind of was. If you look at everything that was available and the kind of customers that were buying those items, most of them were hippies in a sense. I don't know what that definition really means, but that's what everybody believed, that it was only meant for them.
We can make that a whole nother podcast.
Absolutely. So I grew up in that industry, and I had vowed not to ever go in it, only because, well, we never really had that much time to do things on our own because he was so busy making a living for himself and for us. But then after getting an education, I got a master's in engineering and everything. I decided I needed to be in charge of my destiny. And this was an awesome field. It was getting popular. And everybody who, people were literally trying to look into what health food was all about at that point. So I decided to make a complete turn and go into a business for myself.
How far, I mean, from what your father did back then as to today, how far has it come in your eyes?
Oh my God. You could not find a speck of health food in your regular grocery stores. Not a speck of it.
Right.
Now they have a whole health food store within grocery stores. So they've pretty much taken businesses like us and just absorb them, put them right inside big supermarkets. So it has changed quite a bit. Everything is everywhere. I mean, if you go to a gas station, now you're going to find Cliff Bars and all these amazing products that started in health food stores that are available in a gas station now. That's how it has changed.
Wow. So the public health has come such a long way in accepting or embracing this whole concept of the health and wellness, and that brings me to our road of your success, but brings us to a lot of things. And I noticed when I visited your store, and when I do visit your store often,
Mm-hmm.
I do look at supplements, but you're not just supplements. You're about the full nutrition, the whole concept of wellness, and I noticed that, and that's what I really admired about it, because you have well, tell us about your store. In your store, you have a grocery department, right? You have
Yep. We have groceries, we have organic produce, we have refrigerated items, we have sandwiches that are delivered on a weekly basis. We have health and beauty products. We have pretty much A to Z. We are probably one of the biggest retailer of CBD in the state of New Jersey. So we have everything. And when people need advice, they choose us. They're literal saying that they're literally, when they come to the store, they said we needed a good product, so we knew where we needed to go.
Right. I mean, you have so many wonderful. I mean, I would definitely, tell people, and I endorse you 100%, especially just talking to you just a few minutes about your knowledge base from so many different areas. Now, I would like to start to talk, and I know the big elephant in the room, the pink elephant, is COVID, but I would like to talk about pulmonary diseases as well too. So and allergies, a lot of people that are coming to you, and I know it's the autonomic system or the autoimmune system, they're coming for something for a reason. And I know in the medical field, you can't supplement your way out of a bad diet. Like you were saying earlier with your father, people are eating healthy. If you're eating a typical American cheeseburger, French fries, all that terrible, refined carbohydrates, the animal fats, all that, there's no supplements going to change that. But it's
No, absolutely not.
right, and I don't see, the thing is with coming to you, you offer the whole gamut of everything there. So when someone comes to you, and let's talk about asthma. I mean, I came to you, and I came into the store, and I look forward to visiting, and you were there again. But tell me a little bit about asthma, and what supplements that you mentioned for people who are having inflammation or flare-ups or triggers. What do you normally talk about?
So what we do different here is we look at the customers and we look at what their concerns are. We look at their story and we try to figure out asthma could be caused by multiple things. We don't know we don't know anything. We don't have laboratory here to do analysis on your blood or on your lungs or anything like that. We have to strictly go with what you tell us or what we see in front of us, right? So what we do is first thing we do is we listen. We ask questions. We find out what is the asthma from? Is it something that was caused by damage to the lungs in the past? Was it caused by smoking or anything of that nature? Was it caused by something in the environment currently? Or was it caused by currently COVID? We have no way of knowing what happened. So we need to first find out where you're coming from. Once we find that out, then we go to the right products and the right mix of products to give you the best results, basically. So if you come and say that, look, I was exposed to COVID and now I'm having difficulty, that will require a new set of parameters versus somebody who said, I just can't breathe and I don't know what's going on. I'll give you a perfect example. Yesterday was my day off, but I got a call from the store yesterday. A customer was here. She knows me, so she wanted to speak to me, and she goes, I can't seem to catch a breath, but also I have this cough, and it's unproductive cough that's constantly going. The doctor's saying that maybe I have COPD. I'm not sure what's going on. I don't want to go for a major surgery or anything. I need help. I need to do something that is going on for the last 2 months, but I'm not sure where to start. And I said, listen, if it started recently, and if you haven't had COVID, you probably have allergies. And allergies is the biggest contributor to all pulmonary issues currently.
Oh, absolutely. We see a lot of, obviously that you're talking triggers, but I like you said is one is that I mean, obviously you're relying on the people coming in, giving you the proper information. They're giving
Right.
you a symptom. They're asking you to diagnose it. They're asking a
Mhm.
lot of you, which was, I liked exactly what you had to say. But there are triggers. There are different modalities of asthma that we're looking at, whether it's pollen, environmental, like you're saying, if there's allergies, but the allergens are, we're coming into allergy season again as well too.
Mhm.
So when someone comes in, and I mean, do you ever talk about diet with them? Because I know you also.
Well, diet controls how your body reacts. Your immune diet controls your immune system. So yes, diet is critical.
Right.
But right now, it's too late to just change your diet and get the relief right away. So we tell people, yes, diet, go for it. You need that. But at the same time, you also need to take other things that will help with the triggers
Hmm.
and help the body deal with the allergens, basically. So, as in the case of yesterday, I said, listen, I can give you results in less than 3 weeks if we are lucky in about 5 days. but you got to do multiple things, and you got to do them kind of together. So we recommended to her quercetin and bromelain that reduces the inflammation.
Right.
We recommended the allergy hay fever sinus formula, the AHS 22.
Yes. Yes. Yes.
You're familiar with that one. That's an amazing product that works well.
Yeah, we're gonna put up your site on this cast too. We're gonna give everybody this information because and they can discover a lot of this that you're talking about on here. Plus, I'll put up contacts to different things that you have as well. So when people have questions, where do I go for all this wonderful stuff?
Right.
Okay, I'm
right.
sorry. No, you're.
No, that's okay. And then the other thing I would recommend is this powder from the same company called Super Ultra Nutrition. And the reason for that is that will help out balance out your nutrition.
Mm-hmm.
It is packed with superfoods. It has in there beets and other things, but one other thing it has in there is nettle. Nettle is great for allergies. It also has in there quercetin and other bioflavonoids. So it has orange peel, lemon peel, all these things that are phenomenal for the body. But most people don't go out and start eating orange peel or lemon peel.
No.
So you're not going to be able to substitute this product in your diet either. So you will need to, no matter how good your diet is, if your diet was very good, you probably wouldn't need anything for allergies. But if you still have the symptoms, you're going to need these products.
Right.
There's no real way around it.
Right, because a lot of people, if you're eating raw vegetables, if you're eating an anti-inflammatory diet, you're not going to trigger it as much, like you're saying, per se.
Right. Right.
Do you ever have a time where you feel someone comes into your store and they're asking for a supplement, or they're asking for a quick fix, where you say, "Hey, this is this is a little what would I say? This needs more medical attention." Have you ever sent somebody for medical attention when they've come in thinking?
All the time. We do it all the time. Why? Because people are putting so much trust in us that we have a responsibility to my customer's safety. So if I feel that they're doing something that needs more, I've sent a lot of people, I've tell them, like, for example, I'll give you a perfect example. When somebody has Lyme or a tick bite, I advise everybody to go on antibiotics, even though I am very anti-antibiotics for the most part. There are times when antibiotics are needed. When I got bitten by a tick, I didn't hesitate. I took a lot of antibiotic for a period of time, but also I took all the precautions necessary so that my body doesn't suffer in a negative way. So I was taking 450 billion probiotic at the same time.
Wow. Yeah.
And then after, I was supposed to do a 3-week period course, and I decided to do a 2-week course and follow up with colloidal silver for the remainder 1 week. But you got to know what to do. You got to know which colloidal silver to take. You got to know which probiotics to take. So there's a lot of science actually behind all this. And then we're talking about quick fix. I've actually told people, you're in the wrong store. You need to go into a pharmacy if you're looking for a quick fix. Right. I've done that many times, and they look at me, they're like puzzled, like, is this guy crazy? But you know what? If they're looking for a quick fix, we don't have quick fixes.
No.
We have solutions, but no quick fixes. Right. Even the dieting, same thing. There's no quick fix.
Absolutely. I mean, like you said, dieting. I'm a true believer in eating, raw vegetables, healthy fruits, antioxidants, things that help prevent cancer and promote a healthy overall fitness as well too. Now, you talked about asthma and you talked about the triggers. And what about people now, just moving over to COPD? What about people, because with COPD, it's more of a managing it, not a necessarily, you're controlling it, but at that point you're managing the breathing. So is there anything different that you would suggest for someone with COPD?
So first, I would try to find out, is it really COPD, or is the doctor confused and saying it's COPD, even though it's actually allergies. I've seen that so many times.
I'm sure you have. A lot of people, we've seen in pulmonary, there's a crossover between, and I see this a lot of questions. Is it asthma? Is it COPD? Do I have both? Will I get COPD if I have asthma? And there's so many variables in there. How are you taking care of yourself? How are you taking care of your health? Is it some people genetic, some people airway remodeling with asthma? In other words, if it's inflammation constantly, there's so many variables to that question.
Right. So one of the things I from what I understand, COPD is a permanent damage to the lung that is irreversible.
That is correct.
Everything else, I look at it as reversible.
Mm-hmm.
That's how I define COPD. So if somebody actually has true COPD, a few products that they should be looking into are things like NAC, N-acetylcysteine, reduced form of glutathione, possibly, but you don't need both of them. Astragalus, it's an amazing herb. Astragalus is great for lung-related issues. So yes, if somebody has COPD, look into astragalus. Look into the product that we have, the Lung Plus formula from Bioessence International. That also is created just for COPD. So yes, there are different ways of being able to manage even COPD, which, with the other treatment, it involves steroids and other things, which have a lot of side effects. While all of these things that I mentioned have almost no side effects.
Right, exactly. Well, there's a lot of side effects. Anything when you're taking for breathing, whether it's steroids, there's a side effect to every medication. Now, let me ask you a question. I know you mentioned a few things. I know some people ask me about turmeric, and they, because that's another anti-inflammatory. The NAC, that's one that, definitely people should hit on, or I'll tell you, we could take this whole podcast and break it down to just one supplement and talk about that.
Oh, easily.
I know. And that's why I realize when I'm talking to you, it's like, I got the holy grail here. So now, as far as another one is lipotic acid, right? Am I saying that right?
Yes. Alpha lipoic acid.
Yes. Tell me about that, because that's something I started taking when I came in, and I actually changed my personal diet about maybe 4 weeks ago. I was on rescue medication 4 times a day. I have been taking on Spiriva, Wixilla for my asthma, my sarcoidosis. I changed my diet, and around the same time, I started taking the lipotic acid as well. I take the turmeric, I take quercetin. I haven't used my rescue inhaler in 2.5 weeks now. I am now off the Spiriva, and I am on the way to recovery. I'm back on a treadmill again. I'm not short of breath. I'm in the medical field. I do believe in medicine, but I do believe in homeopathic. I believe in a lot of things, but it's seeing is believing, and I'm actually living it. And what you suggested there, and that's why I said this would be an amazing podcast, because people will get so much out of this. I mean, obviously, I didn't just take one supplement. I'm taking a few, but I changed my diet along the way. I cut out animal foods, meats. I went vegetarian right now, so I cut back. But tell me about lipotic acid a little bit.
So it's alpha lipoic acid, and basically it's a nutrient. It's also an antioxidant, but it's one of those magic nutrients. So when people come in for some very unusual conditions, such as ringing in the ear, vertigo, those are all linked to allergies. And one way of helping people recover after you stop the the triggers, or allowing the body to better manage the triggers, is for recovery purpose, you take the alpha lipoic. But here's the other thing. It's also good for people who have lost their sense of taste and smell. Now, nobody was recommending this to anybody. We are the only ones who have been.
We're working our way towards that pink elephant in the room, COVID. So
yes, that's going to keep.
We're going to keep
coming up.
This conversation, because I know people will be hanging on. So what do you do for COVID? And I know that's
Right.
a million things. We're definitely going to talk about that
But
in a minute or two.
but the really important thing though is when it comes to alpha lipoic, there's thousands of companies making alpha lipoic acid products. So how do you choose the right one? That's what we are there for. We help you guide towards the right products, and then the right brand and the right dosage and the right everything to meet your needs. That's where we are different also. And almost all of our customers are referrals, by the way. Just like how you were impressed with the results. Everybody that we get, new customers, they're all sent here by other people who have
Now,
been to
do you
our
get,
store.
do you get people, because you're based in northern New Jersey, do you ever
Mhm.
get people who are in different areas of the country or the world reaching out to you?
All the time. Yes. We have established our name for that purpose. So people do call us many times from other places. I had a woman just before we this podcast started. Her friend's mom is in Poland who has high cholesterol. She's over here visiting, and they want to bring her here Saturday for all the best things for cholesterol.
Wow.
So we see that all the time. Um, that's why it's so important for us. When you said, do you ever recommend people to go see a doctor? Our reputation is so important to us. We want to make sure that what we give our customers advice is the best possible advice. And sometimes that means traditional medicine. There's some amazing traditional medicine out there, and many times the traditional medicine is there to progress, to put a stop at the progression of a particular disease, and then we can do natural things to reverse it. But for sometimes we need to put that brakes on. In the traditional medicine, we call that the brakes.
Right. Now, do you ever have someone when they come in, such as this woman, or people are talking to you? Do you ever talk about obviously the diet as well too, as a prelude to supplements?
We do. We Diet is so important. The problem with diet is most of our customers who are in this are beginning to know that diet is important. And I try not to go too much in the diet myself, only because that itself can take hours of time away. So my focus is always on the supplement side of things. But yes, we guide people, we walk them around, we show them what to look for. We don't find it for them. We tell them how, we teach them how to take care of their own body and become self-sufficient. So we teach them how to shop for
So
better food.
that's perfect because you're teaching autonomy, where people are autonomous, and when people self-discover, when you see a lot of people in wellness or coaches, it's all about the self-discovery. And if you can do something for someone constantly, they're not going to seek it. But I like what you're saying there. Now, as far as your staff, I had a question quick because you're saying, wait, do you have a training for your staff members? Because I noticed a lot of you when I go to your store, I visit your store, I come in. You obviously have people who are behind the counter, the register, but you have people that are kind of experts walking around too, answering questions such as yourself. Um, how do you train your staff? Are they already trained? Do you seek out people?
So we have hired trained staff who are very, very, very qualified in this. For example, we have a guy named Nick. He is well trained and he actually knows so much. He's uh he's he's one of those persons that people come to see besides me to the store. So we have become a destination store because of that. But all the other staff that we have, first of all, most people that we hire have to have some sort of an interest in the industry. And when they have an interest like this and they see things around them all the time, eventually it's bound to rub off on them. So they learn from what they hear when I speak, and when others speak, they are listening in and they actually learn a lot from just that. At the same time, we provide training from other companies. So we have all these companies that are eager to teach our staff. So
Mm,
we invest in the time to do all that. And
mm.
that's the reason why we become better as a store.
Oh, absolutely. You're only as good as your staff, right? You're,
Right.
now moving on just a little bit, a common denominator in a lot of things that we're talking about, obviously asthma, COPD, allergies, there's something that comes along with it, and that is anxiety and
Hmm.
sleeplessness. And I just want to talk about anxiety and stress a little bit because they kind of go hand in hand. And I wanted to know, because there are people who have a lot of, we manifest things in many ways, especially with the stress of COVID, the stress of sickness, stress of the day. And I was just curious, what do you suggest for people for stress? What do what do you
Stress is probably the biggest health crisis in this country.
mhm,
Um, as advanced as our country is, we are falling behind when it comes to quality of life in that respect of stress and anxiety.
mhm,
And I believe part of it is due to triggers like an iPhone and other electronic devices. Also, other things like when you are walk, sitting down, you get all these phone calls that don't really mean anything. They're really garbage calls, but you get them. That triggers stress also in people. Financial instability triggers stress. Personal lives, breaking up of families, all those things are causing a lot of stress in people's lives right now. And it is one of the biggest concern that we see in our customers. And we have different ways of addressing those based on what is the trigger, what are the symptoms. Meaning some people have problem just falling asleep because of stress. Why? Because the minute they lie down, their brain starts racing, thinking about things, and they just can't sleep. So
mhm,
we need to shut the brain. So that requires the product, for example, called Nerve Calm. That basically is one of the best things to just calm the brain. CBD, but the right kind of CBD. There's types of CBD that's good for pain, and then there's the other kind that's good for stress and anxiety. So you need to know which kind of CBD to take. Then there's probiotics omegas. Omegas are very good. Now, if you know, once again, COVID causes anxiety in people lately. After COVID, people are getting a lot of anxiety. Something is going on. My belief is that it is burning up all the reserves of omegas in your body. So you need to replenish omegas, omega 3, omega 6, omega 9, basically all the essential fatty acids.
right.
Now, how would you start taking that? How do you know which one to take, how much to take? What is a safe amount? What is a therapeutic amount? That's where we come in, but that's what we do. So the omegas are very good. Then there's GABA. GABA is phenomenal for people who have stress and other conditions where they have not slept for a while. Um, you take the right kind of GABA product, and you're guaranteed to sleep. The problem with GABA is that if you take it all the time, your body becomes dependent on it. So you want to give it a little break in between from the cycle. So you do it for 2 weeks, take a few days off, and then start again. But then you also want to take the right doses and the right type of GABA with the right blend of other nutrients. So there's a huge amount of science behind all of this.
Right. Yeah.
You know,
Like you said, this is a multi-billion-dollar issue in this country and around the world. Stress, anxiety, that has really flared up, per se, upon a words. But
right?
and you mentioned a very one word you said and that resonated with me was pain. And pain
Hmm.
comes in many ways. Pain can be physical, emotional, psychological. Do you ever find that when people are coming to you, that they're coming to you out of desperation, and you find that you're playing a role of not just, you're kind I'm not, I shouldn't say psychologist for the wrong word, even though you're well educated, but the thing is, you find that you're ever playing the role that, you're trying to talk them not off the cliff, but you're talking to them and connecting with them in that way, that manner, that they're trusting.
Well, they put so much trust in us, so much trust in us that it, in a sense, forces us to be even more careful on how we advise them.
Right.
Because we basically become their secondary medical system.
Yes.
And we don't want to become their primary without them having the right way of doing it, because there are certain people who have certain conditions they do need to be addressed. But at the same time, yes, we are their doctors in a sense, and they come to us because they're so desperate, because the medical community pretty much has failed them. I mean, we get people who have stage 4 cancers, and the doctor have said, we can treat you, and they come to us. And we've had conditions where they've gotten into remission and then cancer free. So
That's
we have had.
I was going to mention cancer. That was my next thing. You just led right into it. But that was the other thing I was saying, the cancers and what you do for them. I mean, just a brief touch on it. I mean, definitely, when people are seeking out cancer, it's very stressful for the whole family. But people are looking for answers. And, in the medical field, we don't always have all the answers. We treat, you have to treat the whole person, not just the disease.
Right.
And
What causes cancer, right? I mean, if you think about it, all these years they've been doing research on cancer, yet they still really don't know what causes cancer.
right.
So my thing is, here's how I look at things. Within our body, there's a flora, this bacteria called probiotics. You're born with it. They're supposed to flourish, and then they control the bad bacteria under control. It is this imbalance of this good bacteria that causes a lot of these issues, in my opinion. And I think that allergies, in my opinion, are also triggered by excessive use of antibiotics. And I believe cancer is a virus that lives in your body. We don't know if it's a virus or a bacteria or a combination of that or a fungus.
Right.
We don't know, but it is something that it's in all of us. But the body is able to control it. It is when it's not able to control it that it gets out of hand. And so if you look at treatments from that point of view, I have a feeling that within next 10 years, they will start giving cancer patients certain types of probiotics or certain type of antiviral things that will actually help take care of the cancer. It is not necessarily just a mutation of the genes that's causing the cancer, but it's a virus or a bacteria that causes the mutation of those genes.
Right. Yeah, we're looking to, you're talking about integrated medicine, integrating it into a lot of areas. I know New York City, Columbia Presbyterian, and other ones are doing it for heart health and other issues too. And I noticed that hospitals are trying, as times come across, they're kind of integrating it in. Now, lastly, I'd like to talk about one last thing. This has been great. This is very informative, and I am going to ask you to come back because I want to just break it down just to a few supplements that you find that people are, coming to you for. But now I would like to talk about COVID and COVID-19. And we talk about the pre and the post where, as they say in the beginning, in the first year of it, they were talking about in the collection phase. We're getting information and data. Now we have more. Now we have an inoculation for it, a vaccine. And people are saying, what can I do? I've had it, taste. There's so many different vitamins you're hearing people saying, from taking vitamin C, zinc, and there's an array of stuff, people who have not caught it. So let's talk about that a little bit. Tell me what you've seen in your experience in your store where people were coming across. I know there was a few things that I actually purchased from you, and little dropper, but you could talk about that. Spicy as it was, I used it, but please tell me about,
So
your experience?
COVID was probably one of the most unusual event in our store's history as well. I know it has been in most people, in a good way, bad way, a lot of different ways. But the most amazing thing is, in January of last year, 2020, we had a black table, little table set up with all the different things that people can do to help prepare the body for COVID. At that time, nobody believed it was going to come here, but we knew it was coming here.
So you're talking
when
to February of 2019, when it,
yes,
right around there before 2000, January.
Correct. Yes. Then once it came, it was just a big event. And I believe a lot of people at that time discovered what Nature's Pavilion was all about and what we were all about. People came from all over to visit us. I mean, literally, I had a nurse who came in March. She worked with COVID patients, frontline worker. And I remember the moment because we were talking and all of a sudden she started crying because she was afraid of that she was going to die from COVID because nobody knew anything about it. And we knew she was a very essential worker, very essential person. And we needed to not only make her feel good, but we wanted to make sure that her health was protected for real. So that if she did get exposed to COVID, which we knew she was going to, just like everybody else, that she can fight it off. So we told her, listen, this is all about your immune system. We know what to give you. We will tell you how to do it. We showed her, for example, we told her to take the CVF drops, that hot stuff that you were talking about. Okay. We told her to take that every 2 hours. We told her to take vitamin C, 3,000 milligrams, quercetin, a good dosage of that, vitamin D, 5,000 I used, NAC, and all these other things. We showed her exactly what to do and how to do it.
Right.
She walked out of the store, and a month and a half later, when she came back, she said that nobody that she works with can believe that she is now taking natural supplement, because she was pretty much anti-supplements initially. And we changed her life basically. And now she was joking around, smiling and everything. And I asked her, how do you feel about COVID? She goes, it's not going to affect me now. It can come to me, but I know exactly how to fight it off. So now I know what to do. I am so much more prepared now than I was a month and a half ago, that now I can function and not have to worry about what's going to happen to me. And that is just one example of what it is. So what we did is we developed a protocol to prevent COVID, or how do you deal with COVID so that you don't get it. So for example, let's say you were in a room full of people and somebody may have had COVID and you inhaled it. What are you going to do? Well, we have this oil called Zen Oil, right? You take a drop in your palm and you just put it in, rub it in, and you just sniff it like this, and it goes directly into your lungs. And the idea is that you want to neutralize the virus in the lungs. You can't do much else with it.
What's in the Zen Oil? What's some?
It's a blend. It is a very complex blend of oils.
Okay.
But it is an oil that it smells great, by the way. And so we tell people, now put it on your mask so that, you're neutralizing everything in your mask and it makes it smell good and you're inhaling this all the time.
Well, that's what when I go from store to store, when I'm wearing them, when I was originally, before I actually got sick and last March, I was putting drops, after that, but I was putting the drops in my mask to help with the breathing, which, essential oils, and I know you have a whole litany, a whole line of that as well too. But
right.
Definitely. But go ahead. I'm sorry, you were saying. So
no, that's okay. So then the other question is, like, what about protecting our customers when they come into the store? What if somebody had COVID and now they're going to spread it to others, right? So we had an answer for that. We took what is known as Thieves Oil. It is a blend of 5 oils. We would diffuse that constantly. So every time you walked into the store, it smelled like cinnamon. There's a reason for it. We were actually neutralizing the air so that nobody else would catch anything, even if you did have it. So think about this. We were working full time, right in the peak of March, April, and May of the COVID just mushrooming. We didn't get sick.
Wow.
How is that possible when we know that people were coming in who had COVID,
Right.
who
Right.
later on found out they had COVID later on? Why? Because we knew what precautions to take. And we teach customers what to do in their own house. And we
Right.
told people, if somebody had COVID, what do you do? So we had a system for preventing COVID from coming. We had a system for what to do when you have COVID or others in the family have COVID. And then we developed a system of what to do after you have COVID and you have breathing difficulty, or you have anxiety, or you have lost the say taste of smell and taste and everything, or other conditions that you may have lingering from COVID. We have protocol for all those things, and they're effective, over 90% effective. I can't say 100 because there's always going to be somebody
Right. You're just never
who,
100%. But so
right.
now,
But that's how effective it is.
so as this woman, she came in, she was able to combat COVID. What about those who have contracted COVID? What and they're going through that? What have you told them to take as far as what this woman was
So
prophylactic or preventative?
So what you do is you take a lot of zinc at that time. I mean, not a lot. I mean, you don't need to take more than 50 or 100 milligram at the most,
Right.
but a lot of vitamin C, vitamin D, all those things. What you do is you load up. And what we notice, okay, this is another thing that you want to understand. Majority of the people who did what we told them to do for preventing did not get COVID. Matter of fact, those drops, the CVF 24,
Mm-hmm.
that we sold thousands of. I just got a delivery of 10,000 more bottles. We had sent out an email multiple times asking if anybody who was taking that as a preventative who still got COVID. And I still can't find a single person who has come forward who said they were taking it every day and who got COVID.
Right.
And that's a very powerful statement.
That is a very powerful statement. Yes.
And only a few people will really understand how powerful that statement is, because people know how bad COVID can be. And you shouldn't just ignore it. But at the same time, you can prepare your body for it. And that's what we teach them to do.
That's right. That's a wonderful statement. That does have a lot of power behind it too, as well. So those people who have had it now and have recovered and recovering, is the regime still the same? Just obviously overall wellness, fitness, health. But are you giving them the same? Is there anything?
No, we are giving them what is known as systemic enzymes,
Mhm.
because that helps dissolve fibrin from your bloodstream. So one of the side effects of COVID after getting COVID is blood clots. And people are getting blood clots. And I had somebody who actually had COVID, who had pain on their legs, and they went to the hospital, and actually it was an actual active blood clot. Luckily, they went to the hospital at the right time. Otherwise, could have had major
Oh,
consequences.
absolutely. Yeah.
So one of the things you do is what is called a systemic enzymes. And we have some amazing products that helps dissolve blood clots. So yes, that is something that you can take. Omegas, omega-3 for the anxiety. People are losing their omega levels after COVID. So yes, people need to take the omegas, but the right types of omegas, the right blend of omega-369 with the right EPA and the right DHA amount in there.
Right.
Then we have alpha lipoic, the one we were talking about before. If they have lost their taste and smell, it's a great product, but it's a great product to take anyway, And then we tell them to load up on the quercetin and bromelain. Why? Because it helps protect the integrity of the blood vessels. Also another important thing.
Oh, absolutely. Yeah, definitely.
So you got to take that, vitamin C. And I just tell people load up on the CVF for the quickest recovery you can get.
Wow.
Even the allergy formula, the AHS, that might help people too because it is affecting the lungs. NAC, you can take NAC if you're having breathing difficulties. So
Right.
yes, there's a protocol for people. There is no one protocol because nobody is the same. Everybody's different. So we have a different protocol based on their conditions.
That is wonderful. That's great. I'll tell you, there's going to be a lot of people asking, what are these protocols? Where can I get them? Where can I find them? And we are definitely going to post them up, put them up, send them in your direction. And I'll tell you, I love everything that you're talking about, Steve. I mean, you're helping your community, but you're helping your community of people that are coming to you for help. And, even myself, I came to you and asked, what can I do? And that's what prompted this podcast, which I think is wonderful.
Well, one of the most amazing thing happened during COVID is people came to us and they thanked us. And you should see the tears in their eyes.
Mm-hmm.
They were so appreciative for us being there when they needed us the most.
Well, I'm thankful.
And we did not close a single day during the pandemic, even though we were hyper understaffed. We had absolutely no staff. I was working. We didn't care as long as I had one person at the register and I was there putting up items that were coming in. I said, I don't care. We will be open.
Wow.
And that's how we did things.
That is amazing. I definitely thank you too. And I thank you also for this wonderful podcast. This has been great.
Well, I think what you're doing is amazing too. So, I mean, it's amazing that you're doing this. This is what we're all about, education.
We're trying to help everybody one breath, one step at a time through fitness, wellness, a beautiful diet, and obviously supplementing yourself. I see a lot of us synonymous and the same things that we're doing, helping people. And, I want to thank Steve. Steve, thank you so much for being here today.
Thank you for having me. It was a pleasure.
And we are, like I said, to everybody out there who is looking for a lot of what we spoke about in this podcast about what Steve has to offer, we're going to be putting that up on our podcast and under here on the information. And once again, thank you. Have a wonderful day.
You too. Thank you.
And
we are here anytime. Anytime you have questions, we are here.
And you got another shipment in, so I'll see you soon, you said.
Yes, of course. 10,000 bottles. So we are set for now.
Oh my gosh. Well, thank you so much, Steve. I appreciate it.
All right. Pleasure being here. Thank you.
Bye-bye.
Okay. Bye.